Hey, Dr. Shakib here from Irvine Spine and Wellness Center. Today I'm going to talk to you about headaches and go over some of the common questions that I was emailed to do a video on, so stay tuned. Thanks for watching. Some of the questions that were asked I was emailed to had to do with headache relief, headaches and migraine, migraine headache, natural treatment for headaches, and the question was how to treat my headaches without any meds or medication. Okay, so after lower back pain, probably headaches is the most commonly treated condition I see in my office, and of course it had to do with the fact that we sit so much behind the computer. So what ends up happening is you're sitting there nice and straight in the morning when you first go to the office, and next thing you know, you're all collapsing there and your head goes forward. So day in, day out, that's your posture. The most common kind of headaches is called tension headache, suboccipital headache, or cervicogenic headache. Cervicogenic means cervix is the neck and genic means generated. So it's a neck generated headache. So the first thing you want to do as far as natural treatment is concerned is obviously do the thing that causes it or stop doing the thing that causes it. What is that? Not staring at your monitor all day long. So I know you're working and your work has to do with your desktop or your laptop. So when it comes to laptop, definitely don't be looking down. You need to elevate your laptop and perhaps get one of those wireless or even regular keyboard where you can do the typing. So make your laptop become more like a desktop. These are the things, the measures you need to take. Small things you can do throughout the day that will stop you from having these big issues. So that's number one. The other thing is take basically micro breaks, meaning you get up, move around for a few minutes, and then you come back and sit down. It's only going to save a few minutes of sitting behind your desk, thinking, okay, I've got a lot of stuff to do. But the reality is, the more you do these things, the less headaches you have, and then it's not the headaches that's causing you to stop doing what you're doing. So let's just be logical here. So tension headache or suboccipital headache is basically comes from the back of your head, back of your neck, where the head goes forward. They try to contract to bring the head back in the position. So one of the things that I recommend, and it's on my biohack ebook, which is on my website, I'll make sure I put the information down in the description box here, but one of the things that I do is as I'm driving, and if you're going to work, I'm sure that you encounter a few red lights. So what you want to do at the time of red light, glide your head back. Gliding your head back is not looking up or tucking in, but it's as if it's a train car that is on the train track. So you glide it back and you hold it for the whole duration of red light. That causes contraction of these muscles in the back and actually strengthens it. So, my biohack ebook has to do with the 17 different things I do throughout the day that I don't have to take extra time with. So check it out. It's not a big deal. There's nothing you're going to lose. And then you can just start implementing it into your daily routines. I have done a whole video on the different acupressure points that I refer you to. So make sure you subscribe to my YouTube channel and you go under playlist headaches. And then if you scroll down, you will see the acupressure points for headaches. So start utilizing those. For women, when it comes close to our period or ovulation, sometimes both, there's a hormone called Relaxin. They used to think it was only seen in pregnant women, but that's not the case. In my practice, from what I see, so this is pure anecdotal, but I'm convinced that's the case, majority of women have this issue. The hormone Relaxin relaxes the ligaments, so if your head is here, it's going to be more there, and your muscles to bring your head back don't have the strength to begin with from your lifestyle, so then it becomes an issue. What do I do? By the way, I do get headaches myself, and it's one of those types of headaches that it skips a generation. So my mom didn't have it, my grandmother had, so I guess I'm lucky now. But hey, at least my kids are gonna be good. But when it comes to that, I do more stretching, so I up my stretching, and I'm more careful to take a lot of breaks. My lifestyle is not similar to most people. I do get up and move around a lot. Dietarily speaking, you want to make sure that you eliminate anything with caffeine. So that's coffee, Coke. Please don't get Diet Coke. That's for a different reason. And then also wine, GMOs, genetically modified things, any additives. Those are the dietary restrictions you should have if you generally get headaches, but more so for migraine headache. Now let's clarify, not every bad headache is a migraine headache, so don't use it loosely. Just because you have sensitivity to light or to noises, that does not make it a migraine headache. So don't use it loosely, and don't misdiagnose, and don't get sucked into that. There is another kind of headache that I see. It's typically associated with jaw pain, either both sides or one side, or tension there, grinding the teeth. And also take a look at your pictures in your album or whatever, and see if you have a head tilt. That typically is an indication of an overactivation of the midbrain. It's called mesencephalon. You don't need to know that, but typically for those, you can get the pinhole glasses. You can get them off Amazon if you want, and as you feel like it's about to come, start wearing it. That has to do with overstimulation of mesencephalon, and it typically is from too much lighting. Once again, monitors play a huge role there. What else is there? I think that's about it. I hope that you enjoy this. Make sure you get my biohack ebook on my website. I'll make sure all this information is down here. Shoot any emails that you may have. Subscribe to my YouTube channel. Seriously, what do you have to lose? This is just packed with, I think last time I checked out, like 140 different videos on different things. These are things that I'm inspired by my patients throughout the day, and it's like, hey, I better do a video there. And then also Facebook. Follow me on my Facebook page, Irvine Spine and Wellness Center. This is where I typically interview with an outside expert on a specific health subject. I do it 2 times. I may start doing 3 times a month, and it's available there in a video. You can watch these things. All of these resources I'm doing for you, just so you take control of what's going on in your life. It all has to do with prevention. It's so much easier to prevent something than to have to deal with aches and pains and issues. Anyway, I love you guys, and hope this helped. Take care.